In order to have good comparability across sites, when you have multi-center trials, you really want to have all the testers be trained by one person and to have really good quality control. One of the things that you need to do is to make sure that you're reducing the noise in the system. That is, all the variability that could occur because of a tester who doesn't understand the disease or doesn't understand the test, or a poor environment for testing. You have to be very sensitive to things like that. What kind of a room are you doing the testing in? You don't want to do it in a medical exam room where a kid may be very anxious about the fact that they just had a procedure in a room like that. You want to have a non-distracting, calm environment that the child can be comfortable in. And you want to have parents involved as much as you can, particularly in very young and very impaired children. You need to have parental, maybe the parents in the room, and certainly with very young and impaired children, you want to have that. There are many tricks that one can use to get a child to behaviorally comply. I guess tricks is not a very good word, but techniques to make a child feel more comfortable, and the tester has to feel comfortable with children who have behavioral problems and not give up on testing. Often the reason that children have behavioral problems is because the items are too difficult for them to be successful at, and so they'll be distracted or they'll move off task. So the tester has to be very sensitive to that sort of thing. And that's something that you can be trained in. And so training of testers in clinical trials and in natural history studies is a very important part of the procedure.